Thank you, Ed. Once again, this is another great discussion by this panel. So I thank you all for joining us. I have a couple of quick questions, maybe not so quick answers, though, from you. I'm wondering any policies that were put in place since we first identified that we're in this pandemic in New York, specifically anything rolled out by the legislature or maybe the governor's executive orders. Do we know if, from your point of view, if there were any specific orders that may have hindered some response in our communities? And that's open to anyone on the panel.
I would like to just start by talking about testing in the country, not just in New York State, in the country. The whole strategy we have still is a very medical care centered strategy, testing individuals one by one. It used to be restricted to symptomatic, and now we expanded to the first responders, and now we're in some of the prisons and some of the nursing homes and doing universal testing. But we still don't have the population-based public health surveillance kind of testing where we could know that a probability sample. Public health departments do that all the time. You sample people and then you know that today this is the estimated prevalence plus or minus 1% of the infection in your community. If we were to do the population-based public health surveillance testing, including asymptomatic as well as symptomatic people, we would be able to go beyond documenting the course of the pandemic to actually changing the course of the pandemic. We would be isolating all of our positives, especially the asymptomatic positives. And we need to isolate them in safe ways, not necessarily sending people home to multi-generational families in 2 rooms. But we do the isolating, especially of the asymptomatic as well as symptomatic, then the contact tracing, then the quarantine, and then we could get a handle on the pandemic, as opposed to just having a 2-week-old estimate of what the infection was 2 weeks ago if we're just looking at symptomatics, a 3 to 4 week old estimate if we're looking at deaths. It's not the way to do public health.
Thank you.
Perhaps chime in that strategic testing should also be prioritized in vulnerable communities. We prioritize nursing homes, we prioritize healthcare workers, which we should, but we should be prioritizing vulnerable communities and in a strategic way. And I think we were behind the curve a bit on that because of the delayed testing. I think also, I'll just say one more thing. The difficulty in getting race data that was brought up earlier, I think that was not well done at all from the beginning. And that's something that we should insist on and should be continuous.
So in absence, I only got 2 minutes left. I want to touch on something else. I apologize. It was mentioned before about NYPD enforcement, especially when it came around to social distancing and wearing masks. And I want you to understand that being a former lieutenant in the police department, I thought it was a bad idea from the beginning. I thought that the NYPD and all law enforcement should just strongly be encouraging, not driving a wedge between our communities that we've actually built a relationship with that was hoping and promising going forward. I think this just actually put a stronger wedge in it. But I want to touch more on the racial disparities. And a few years ago, before I was elected to the Assembly, I was a member of the Community Education Council for Staten Island, which is the school board. And we worked on this project called Building Empathy, Equity, and Excellence. And it was more about a systems thinking. And one thing that I think we can really use is we have a model now with the regions in the state. We can put together those systems thinking strategies in those regions and build upon our community organizations so we can get past those inherent biases that we all have. And if anybody denies that they have inherent biases, they're wrong. That's the first thing that we did during that work was acknowledge that we all have it. And that's the first step to getting past it. So if you can quickly touch on that.
Assemblyman Reilly and my Buffalo brothers and sisters, Brooklyn is doing very similar work. When I heard you, I've heard now several times the term of arts, SDOH. We're doing similar work with our PPS in Brooklyn, working with hospitals, community health providers, faith institutions. We're covering half of Brooklyn, about 1.2 million of the 2.6 million residents in Brooklyn. We've also been using the participatory action research model as well. So we have students. I'm at Medgar Evers College, and we have students from the various CUNY campuses. There are actually 4 in Brooklyn. We're doing community ground up, people-driven solutions. They are literally trained to conduct surveys, interviews, focus groups with community residents on the ground, with health professionals, with hospital workers. And then we're putting that information together to come up with an analysis of what the residents say are their needs, participatory action research, making sure, Dr. Jones, that the residents are at the table when we're formulating solutions to the challenges of quality healthcare delivery in these various neighborhoods of Brooklyn.